Let's see the chest drain procedure for hemothorax. Prepare the following equipments: surgical gloves, mask, local anesthesia, surgical markers, scalpel, syringe, needle, Scheldinger chest kit, and suture kit. First, begin with washing your hand and then putting on your personal protective equipment. Before beginning the procedure, obtain informed consent from the patient or the patient's representative. Let the patient to be in the supine position. Use surgical marker to mark at the lower border of axilla to the fifth intercostal space, the lateral edge of pectoris major and the lateral edge of the latissimus dorsi. Apply the sterile field with antiseptic. Then apply sterile drapes to the incision area. Now I'll show you how to do the procedure using a sponge. Then inject lignocaine or local anesthesia cutaneously, subcutaneously, and then into the pleural space. Take the Scheldinger needle and attach this to the 10 ml syringe provided. Insert needle in the same plane as the lignocaine, aspirating as you advance. Insert needle to the same distance as air was aspirated with the green needle. Once air is aspirated, insert 0.5 cm further and confirm the ongoing aspiration. Remove the 10 ml syringe, ensuring you place your thumb over the open needle. Take the Scheldinger wire and insert through the needle. Ensure you hold the wire and the needle at all the time. Take the scalpel and make 0.5 cm incision in the skin. Remember, scalpel sharp edge should always face away from the wire. Remove the Scheldinger needle over the wire. Take the Scheldinger dilator and pass it over the wire. Gently but firmly insert the dilator over the wire through the skin and to the intercostal muscles. Warn the patient if they feel some pushing. Do not be too forceful as you will kink the wire. If the dilator is not advancing, it may indicate you that you are pushing in the wrong plane or against the bone. Once dilated, remove the dilator and pass the chest drain over the wire. Ensure you have a hold over the wire out the end and the drain before advancing. Then, create an occlusive dressing to place over the chest tube. Make sure to provide enough padding between the chest tube and the chest wall. Lastly, attach the drain to the chest drain tubing. Always remember, after the procedure, wash your hands or use alcohol-based hand cleaner. Perform a general safety check of the patient and environment. Remove procedural trash and contaminated linen when you leave the room. Discard in appropriate container or location according to the facility policy. Document the procedure, your observation, and the patient's response.